Okay. Hello, everybody, and welcome to our debate on neurodiversity affirming practices. My name is Lauren Greeley, and I am a part of the PRO group.
My name is Ashton Bott, and I'm a part of the con group.
My name is Jasmine Garcia, and I'm part of the PRO group.
And my name is Elila Torres, and I'm part of the con group. So the term neurodiversity was first coined in 1998, made an appearance from the autism self-advocacy movement in the late 1990s. This movement argues that neurodiversity is in neurological development and functioning, and supports the idea that neuro is a natural and valuable part of human.
Culture also plays a large part in these practices. According to Simmons, ASD is perceived, treated, and supported differently across all cultures. For this, we should look at not only the culture of the client, but the culture of the professionals as well. Cultural biases can play a role in unfair treatment, as well as the goals that the neurodivergent families and clients may have.
Neurodiversity is defined as perceived variations seen in cognitive, affectual, and sensory function differing from a majority of the general population or predominant neurotype, more usually known as the neurotypical population. Neurodiversity affirming practices use the strengths of the client to develop interventions with no comparison to neurotypical individuals. While there are effective results, there is a debate as to whether or not neurodiverse affirming practices prepare neurodivergent clients effectively for the real world.
At the end of this presentation, there would be a time for questions and answers.
Our first topic is about the strength-based approaches to the learning of neurodiverse practices. The idea of strength-based approach is using the skills they already show to build on. Practices that do not approach neurodiversity may attempt to build the student base of neurotypical abilities. Developing treatment that revolves around neurotypical levels does not acknowledge gaps in the learning of neurodivergent individuals, as learning is not linear. Neurodivergent affirming practices use the learner's interests to build on their abilities and knowledge. For example, using a learner's favorite action figures to teach prepositions instead of giving them a worksheet on prepositions. Strength-based approaches also establish more motivation for the learner. A learner is more likely to engage in educational activities if they begin with skills they already know. This way, the task is not seen as daunting. This motivation can also build autonomy for a learner. With confidence in a skill comes autonomy. We as people are more likely to begin a task if we are familiar with the fundamentals of the activity. Beginning any intervention with the strength-based approach and reaching generalization could have more effective outcomes later on in intervention. Mulligan and colleagues looked into the effectiveness of strength-based approaches across 135 neurodivergent individuals. Results showed a significant improvement in self-efficacy and anxiety in the neurodivergent individuals following their strength-based treatment.
While it is important to build on skills those with autism already show, their needs also need to be diverse and their skills need to be applicable to many different situations. As stated by Cutting, a lack of skill building on neurotypical activities can hinder them in finding a job or maintaining or making friendships. Some activities should be focused on, such as occupational skills as well as social skills, in order to help those with autism maintain friendships or be able to keep a job. This is directly related to Ethics Code 312, which is advocating for appropriate services, as those with autism deserve effective, equal, and appropriate treatment. Appropriate treatment may also include considering what activities the client may want to work on, as they may want to work on deficit-based activities instead of strength-based activities. Without working on these deficit-based skills, those with autism may struggle to reap the benefits of social camouflaging.
However, the concept of neurodiversity embodies the strength-based model that shifts the focus away from the challenges of individuals with neurological differences in favor of finding ways to work with their strengths. we should be asking the question, what can the individual diagnosed with autism do, instead of asking and recognizing what they cannot do. For example, difficulty with social interactions, communication, and so on. Embodying a strength-based approach can be beneficial by allowing these individuals to have self-confidence and be empowered despite their diagnosis. By doing so, we avoid seeing individuals with autism as a defect that needs to be corrected. Taylor and colleagues conducted a study in which they compared the strength-based model with individuals diagnosed with autism and those who don't have a diagnosis. The outcome of the study showed that individuals diagnosed with autism showed to have a better quality of life, subjective well-being, and lower levels of anxiety, depression, and stress. This study poses the strength-based model to boost well-being in individuals diagnosed with autism. Now, as future BCBA, using this strength-based model clinically will connect with within our ethics codes. The first ethic code is Ethics Code 2.14, which is selecting, designing, and implementing behavior change intervention, which states behavior analysts select, design, and implement behavior change interventions that 1, are conceptually consistent with behavioral principles, 2, are based on scientific evidence, 3, are based on assessment results, 4, prioritize positive reinforcement procedures, and 5, which is the most important one, best meet the diverse needs, context, and resources of the client and stakeholders. Now, the second ethics code is 3.1, which is a responsibility to clients, which states behavior analysts act in the best interest of clients, taking appropriate steps to support clients' rights, maximize benefits, and do no harm.
While the concept of neurodiversity is meant to be based on a strengths-based, it is instead often based on a deficit model of understanding. As mentioned above, Ethics Code 2.14, selecting, designing, and implementing behavior change interventions, is made up of those 5 components. This component highlights our duty to meet these diverse contexts and resources of our clients. Instead, the often on controlling or masking behaviors that are typical in nature. Factors that should be considered in service learning delivery are mentioned in this code include risks, benefits, and side effects. If we're aiming to focus on the strengths-based model, but instead interventions that are based on the deficit model of understanding, will be enabled to reach maximum benefits and increase the risk of negative side effects. Ethics Code 3.1 does emphasize the responsibility behavior analysts have towards their clients. Behavioral analysts are to act in the best interests of their clients and take the appropriate steps to support clients' rights, maximize their benefits, and do no harm. Another point to mention is that individuals who do not have autism are often the same individuals who create these interventions to control behavior and differing cognition as a deficit. Instead, a diversity model of understanding should be used, is neurodiverse individuals as part of the range of natural human variation and not deficit. ABA interventions that are developed from a diversity model of understanding will have a better possibility of prioritizing the benefit of the individual instead of compliance to societal norms.
Our next topic in the debate of neurodiverse affirming practices will be the topic of communication. Behavior is often communication of a need or a problem for a learner. For example, a learner crying and flopping to the floor around 11 o'clock each day when they are hungry. That is their way of communicating. Neurodiverse affirming practices find this function and teach them the alternative communication of saying, I am hungry. Neurodiverse affirming practices such as applied behavior analysis, or ABA, works on figuring out the function of the behavior to better understand what is being communicated. A functional behavior analysis could be conducted to develop said functions. An FBA is completed to figure out how the behavior is being continuously maintained, whether it is the environment or how others react to the behavior. An example of determining the function of a behavior could be when a child cries whenever his mom tells him no to getting candy from a store. When he cries long enough, she decides to buy him the candy. The mom is reinforcing the crying behavior by providing the candy each time he cries. Once a function is developed, we can teach the learner ways to communicate their needs in a more appropriate way. This could mean teaching them to vocalize their feelings through their own vocals, ASL, American Sign Language, or an augmentative alternative communication device or an AAC device. We could also teach them to use text or a picture exchange communication system. These are all ways that neurodiversity affirming practices use the present behaviors to develop a way to functionally help a learner.
So while teaching communication is critical, there is little literature to support the maintenance or the generalization of the long-term use of these alternative methods of communication, such as ASL, PECs, and AAC devices. If the individuals find themselves in a setting where the listener does not understand these methods of communication, or the speaker does not have the same means to communicate, example, them forgetting their textbook or their AAC device, the individual may resort back to original methods of communication that can be non-functional or harmful to themselves or others. True behavioral change is demonstrated if properly sustained and generalized. So if they are unable to generalize this, Ethics Code 2.1, providing effective treatment, is no longer being upheld. Another counterpoint is that research is demonstrating that both neurotypical and neurodivergent face what they call the double empath problem. Instead of the lack of understanding and communication being one-sided coming from the individual with autism, it is instead a mutual miscommunication between both the neurotypical and the neurodivergent. According to Pantazakas and Vanakin, this double empath suggests that the experiences and communication between someone who is neurotypical and neurodivergent differs so extensively that it's even more difficult to understand each other effectively.
Our third topic includes a discussion of trauma-informed care. According to Carlson and Giving, lived experiences of each person is prioritized. Not acknowledging past traumas can delay progress for learners during intervention. Toole in 2023 says, being trauma-informed allows interventions to be tailored effectively toward the person. Being trauma-informed allows for you to develop an intervention that does not accidentally trigger a learner if they have past traumas. For an example, if a learner has past physical trauma, ensuring none of the interventions involve physically prompting that could trigger that learner's trauma. Triggering a learner's trauma, in this case, is causing more harm to the client and could make an intervention ineffective as the learner would not be receptive to it. Trauma-informed care can be directly applied to BACB Ethics Code 1.7, Cultural Responsiveness and Diversity. The code states that behavior analysts should be knowledgeable and address their clients' needs when it comes to their diverse needs and backgrounds. While this code often applies to backgrounds such as religion and cultural differences, it can be applied to the case of trauma-informed care. Someone who experienced trauma is living a life with a different past experiences from our own. Neurodiversity affirming practices can use their knowledge of the client's diverse experiences to find an intervention that suits them best.
Well, although there is little literature on the limitations of neurodiversity practices, many firsthand accounts of individuals with autism express negative experiences. While the intention of being proactive and effective is there when it comes to trauma-informed care and neurodiversity practices, it's important to recognize that some of these practices are seen in a negative way or in a negative light by the very individuals that we're trying to help. Instead, some studies show dissatisfaction and express the idea that the focus of these practices is often on fixing or correcting behaviors of those diagnosed with autism. This can then be created by the idea that ABA strategies frame autism as a detriment to the individual diagnosed, supporting the deficit model of understanding instead of a diverse model of understanding. Individuals with autism are not seeking to be indistinguishable to their peers. Instead, interventions should be aimed at helping and supporting the individual in managing themselves without altering them as a person.
Now, to elaborate more on trauma-informed care, the components of it are to A, acknowledge trauma and its potential impact, B, ensure safety and trust, C, promote choice and shared governance, and D, emphasize skill building. Therefore, when providing treatment to neurodivergent individuals, we want to make sure that we are assessing and honoring client assent, which will eliminate escape, extinction, and compliance training. Now, what does this look like? Well, when the individual shows signs that the demand is non-preferred, either through showing behaviors targeted for reduction or other forms of functional communication, the client is telling us that at that very moment, they are uncomfortable with what they are being told to do. We should avoid teaching them to comply with every adult and demand, and instead, we should teach and help them build more self-advocacy and assent withdrawal.
We must also listen to those with autism that are stating that regardless of the trauma-informed care and training that those receive in ABA procedures, harm is still being caused to them. While trauma-informed care may be a band-aid for some of the problems that those with autism face, other alternatives still must be considered. Heselton states that the need for those with autism to have more of an impact on how their treatment is done and how they are affected by it, both positively and negatively. In order to follow Ethics Code 2.01, providing effective treatment, those providing the services must take into account what their clients deem as a goal and what they deem as having a negative impact on them.
Another topic to discuss is the idea of rejecting neuronormativity. Carlson, Giving, and Guy stress the importance of rejecting neuronormative ideas. Neurodivergent and affirming practices do not compare neurodivergent individuals to neurotypical individuals with unattainable goals and standards. Taking a neurodivergent learner and not adjusting their learning needs can set them up for failure. There's also a risk of forcing neurodivergent individuals into masking. Masking can be defined as concealing or camouflaging neurodivergent traits to pass as neurotypical. Setting neurotypical standards for neurodivergent individuals can encourage this idea of masking. According to Radulski in 2022, masking can be dangerous for neurodivergent individuals as it can cause some harmful long-term consequences. Some of these consequences include an increase in stress, mental health issues, and identity loss. Neurodiversity affirming practices do not try to have the learner hide their neurodivergent traits as long as they are socially appropriate and not harmful to their daily functioning. These practices will not set unattainable goals for a learner, and it will allow them to express themselves as an individual just as everyone else is able to do.
While neurodiversity affirming practices state that it is important to not compare those with autism to neurotypical people, this is not always the case. Without the comparison of those with autism to others, these practices do not treat everyone as equal. Instead of treating those with autism as equal to others, they set lower goals or standards that do not set those with autism up for society and real-world problems such as bullying. As those with autism are not treated as equal to their neurotypical peers, a lack of resilience is built and mental health problems grow. Those with autism already face enough adversity as is. If they were provided with opportunities to be more similar to their neurotypical peers, there would be less bullying and a better sense of self-esteem.
Now we will talk about the autism spectrum disorder as a disability and a neurodiverse affirming practice. The term disability has been misunderstood for years. What we know about disability is mainly through the medical model, which defines it as a deficit or something that needs to be cured. Disabilities have often been approached as an inability to execute activities that are deemed normal by society. Let's dive into the specifics of the two definitions of autism. According to the Diagnostic and Statistical Manual of Mental Disorders, autism is a neurodevelopmental condition characterized by persistent deficits in social interactions, communication, and maintaining relationships. The medical model defines autism as an assumption that something inside the person is wrong or broken, which leads to ableism. An example of ableism is discrimination in favor of able-bodied and able-minded people. For example, favoring a non-disabled person over a disabled person. Now, clinically speaking, ableism would be prioritizing particular problem behaviors such as stereotypy because they are completely different from how neurotypical individuals behave. With a neurodiversity affirming practice, it will help individuals to thrive in their lives rather than to behave normally, and also give them a stance to who they are rather than defining them as a definition.
Well, because autism and the term disability are often seen under the same umbrella, the medical model is often what is followed. Those diagnosed with autism are treated with the goal of making them indispensable peers. Although autism awareness is increasing, there's still interventions that are implemented on the basis of blending in with peers. Instead, we argue that interventions on reducing autism symptoms are unlikely to be effective. Studies have shown a positive correlation between autism symptoms and quality of support. If we're basing our interventions on how autism can be camouflaged, this is not promoting acceptance.
Being deemed as normal also allows for better physical and mental health overall. Rather than placing so much stress on how those with autism are different, more stress should be placed on how they're able to do similar things that may take a different form from others. Without a feeling of normal for those with autism, there are more negative impacts on mental and physical health. Those with autism also feel the need for acceptance, and if that is not given, bullying and lower self-esteem can lead to depression and anxiety.
Next, we will talk about the aspects of life within the neurodiversity affirming practices. Neurodiversity affirming practices are essential to ensure that neurodivergent individuals can thrive in various aspects of life, including education, employment, and social interactions, as well as healthcare. In educational settings, neurodiversity affirming practices involve implementing inclusive teaching methods, providing accommodations and support services, as well as promoting awareness and acceptance. Within employment, it involves creating an inclusive hiring process, offering reasonable accommodations, and providing support and training for neurodivergent employees. Now, with social interactions, neurodiversity affirming practices involve providing the opportunities for social connection and support and promoting education and awareness. Lastly, in healthcare settings, neurodiversity affirming practices involve providing culturally competent care, understanding and accommodating sensory sensitivities and communication differences, and promoting self-advocacy.
So, although neurodiversity practices encompass interventions where neurodivergent individuals can thrive in various aspects of life, some practices have been linked to high incidences of stress, anxiety, and social alienation, suggesting that these practices are not always effective and helpful or supportive. While neurodiversity practices focus on behavioral outcomes that allow individuals to participate in society, research has only shown outcomes of interventions and that do not have outcome or the effects that these practices have on mental health and emotional health. Another important point to make is that there is a lack of concrete methodological principles regarding the incorporation of neurodiversity into clinical work. Current neurodiversity framework consists of ethical guidelines rather than concrete methodological principles that can be implemented objectively.
Now, our final points for our arguments. Overall, neurodiversity affirming practices promote a more inclusive, accepting, and equitable society where individuals of all neurotypes can thrive in their lives. Neurodiversity affirming practices also contribute to the development of diverse and inclusive communities. By embracing neurodiversity, these practices promote environments where individuals are encouraged to express their unique identities and perspectives without fear of judgment or exclusion. This inclusivity not only benefits neurodivergent individuals, but also enriches the experience of everyone within the community, promoting empathy, understanding, and collaboration across diverse backgrounds and abilities. Ultimately, neurodiversity affirming practices help build stronger, more resilient communities that value and celebrate the full spectrum of human diversity.
So some of the final con points, while it's not mentioned, some neurodiversity affirming practices detract from what individuals would do and stress. Another final point is that more funding is utilized for quality of services and not enough funding towards what individuals with autism actually need. Furthermore, despite the positive trajectory of neurodivergent practices, it's still not being proportionately accepted in the field of clinical. This gap can be exemplified when examining the autism funding allocation that highlights the under prioritization of research needs of those diagnosed with autism and services tailored to them. According to the 2018 portfolio analysis by the Office of Autism Research Coordination, 6% of both private and public funds went towards researching the quality of service, while only 2% were utilized in research of those individuals. If the main objective is to promote neurodiversity as part of natural human variation and from the deficit model of understanding, funding should be allocated to researching the specific needs that they need individually.
Neurodiversity affirming practices use the strengths of their client to develop interventions with no comparison to neurotypical individuals. While there are effective results, there is a debate as to whether or not neurodiverse affirming practices prepare neurodivergent clients effectively for the real world. For this topic, our group is on the pro side for neurodiversity affirming practices, as it is better for the client and focuses on their strengths rather than their deficits, and it is more appropriate as neurodiversity affirming practices do not try to force a client into social norms.
Some of our questions that we can answer are: what challenges do neurodiversity affirming practices help with? They can help with skills that will generalize to classrooms, communication, and behavioral needs, such as emotional regulation skills, coping skills, and behavioral modifications. Another question is: how does this type of practice help with children that have stereotypic behaviors? Neurodiverse affirming practices may help stereotypic behaviors in the way of shaping those behaviors into more functional ways. These practices do not attempt to stop stimming behaviors, as those are neurodivergent traits that are most of the time harmless to the learner or the people around them.
Our next question is: what aspects of neurodiversity affirming practices need modification or to improve on? Well, neurodiversity affirming practices are designed to create inclusive environments that respect and accommodate individuals diagnosed with intellectual disability. While these practices have made significant differences in promoting acceptance and understanding, there are still areas for improvement, such as accessibility, which is ensuring that neurodiversity affirming practices are accessible to all individuals; education and awareness, which is increasing education and awareness about neurodiversity affirming practices among other populations; and advocacy and representation, which means increasing the voices of neurodivergent individuals and advocating for their rights and needs. By being aware of these areas of improvement, we can continue to build more inclusive and supportive environments for neurodivergent individuals.
Another question we have is, who would you ask about their opinion on neurodiversity affirming practices, researchers or those with autism? As a group, we would rather hear opinions from those that have autism that participate in these neurodiversity affirming practices, as it would allow us a better understanding of how it is either beneficial or has a negative impact on their life.
Our final question is: in your culture or community, how is autism spectrum disorder viewed or perceived? In the community, autism spectrum disorder is stigmatized and causes the individual and alienated or isolated. Parents find themselves struggling under pressure of societal approval, financial constraints, inclusion, stereotypy, and judgment for exacerbating this stigmatization. Although autism awareness is helping to stigmatization in communities, it still validate the experiences the individual and their families face and continue working as a field to spread awareness and acceptance.